A Department of Defense medical team started their 30-day stay at Sparrow. They were welcomed by some relieved hospital staff that have been fighting the COVID-19 pandemic for nearly 2 years. 6 News reporter Josh Sanchez was there to find out how soon the team will be treating patients. Josh?
Sarah, the team of specialists come from around the country and some as far as Hawaii. And this weekend, they'll be trading their uniforms for scrubs to help medical staff that are facing long hours and shortages.
Even after the ceremony this morning, their arrival, a staff member came up and actually gave me a huge hug saying, just so thank you so much, how much this means to her and to the staff in terms of knowing that they've gotten this help because they've been holding on so long, hoping that there'd be more help to arrive.
James Dover, Sparrow Hospital's president and CEO, says the sight of Army green uniforms is a sign of support, especially in parts that need an extra hand, like the night shift, ICU, and emergency room. The team of more than 20 members include physicians, nurses, respiratory specialists, and command staff. Dover says the soldiers will be mixed with Sparrow staff to help alleviate stress in departments hit the hardest.
Emergency room has been completely impacted during this time period, and particularly with the Omicron variant, where we've seen on any given day 50, 60 people waiting for an inpatient bed. They're essentially an inpatient being taken care of in the inpatient in an emergency room setting.
Representative Alyssa Slotkin was there to welcome the team. She says that deploying medical teams like this around the country show that the pandemic is far from over.
And I really have felt for the past 2 years that COVID is, the front lines of America's latest war. And our nurses and doctors have been serving on those front lines largely without relief for 2 years.
Slotkin says the process of getting the team to mid-Michigan took the coordination of state and federal officials and hospital staff. Currently, 5 other medical teams have been deployed to hospitals across Michigan.
Many, many more have asked, and that was part of the conversation we've been having over the last almost 2 months, right? Is there's a lot of competition for these resources.
Now, the team will be here for initially 30 days with an evaluation at the end to help decide if there is still a need. But Dover says that he already expects to request an extension of the deployment. Sarah, back to you.